Welcome to the Functional Medicine Radio Show with your host, Dr. Carri Drzyzga, known internationally as the Functional Medicine Doc. Dr. Carri is committed to helping patients find the root cause of their health problems and fixing the cause with natural treatments so they can feel normal again. Dr. Carri is the founder of Functional Medicine Ontario and is the author of the hit book, Reclaim Your Energy and Feel Normal Again. Please welcome your host, Dr. Carri Drzyzga.
Hello, everybody, and welcome to the Functional Medicine Radio Show, the only internet radio show dedicated to giving you real solutions to improve your health. Not only are they real solutions, but they're natural solutions as well, because as you know, the one and only true wealth you have is your health. I'm your host, Dr. Carri Drzyzga, the Functional Medicine Doc, and I am committed to helping you find the root cause of your health problem, fix the cause with natural treatments, so you can feel normal again and live your life to the fullest. Just a quick bit of housekeeping before I introduce today's special guest. I'm happy to announce my first book is now in print. The title is Reclaim Your Energy and Feel Normal Again, Fixing the Root Cause of Your Fatigue with Natural Treatments. I've discovered 14 root causes of fatigue. I like to call them the fatigue factors. And in this book, I explain 8 of the 14. I've had some amazing feedback on how easy it is to read and understand. It's not full of the technical doctory language like most books written by doctors are. And of course, the book also contains my own personal fatigue story, along with 4 other stories from real fatigue cases from my private practice. It's available in paperback and Kindle form, so if you'd like a copy, you can find it on Amazon or on my website, www.drcarri.com. That's it for our housekeeping, so let's get started. I'm very excited about this week's show because my special guest is someone that I greatly admire, Mr. Jamie Glick. Let me tell you a little bit about Jamie. Jamie is a licensed physical therapist and graduate of the Columbia University program in physical therapy. He has over 15 years experience with a private practice in Huntington, New York. His blog can be found at www.howtohelpbackpain.com, and he is the host of the Pain Free podcast on iTunes and Stitcher. Jamie specializes in spinal rehabilitation in his physical therapy practice. Jamie, thank you so much for being my special guest today on this episode of the Functional Medicine Radio Show.
Thank you very much for having me, Dr. Carri. I appreciate you having me on.
Jamie, as you and I know, low back pain is very prevalent in our society today. As we've gone from a hunter-gatherer society where we were always quite active and upright to a society that mainly sits. We sit at our desk, we sit in our car, we sit on the couch. We're sitting doing this podcast right now.
Right.
All this sitting has dramatically increased the amount of back problems that people suffer with. You see it every day in your office as a physical therapist, and I see it as a chiropractor too. Jamie, can you explain to our listeners and help them understand the common misconceptions and misunderstandings people have regarding their low back pain diagnosis and treatment?
Sure. I think a lot of the misconceptions are rooted in, I guess what you would call probably, I know you're in Canada, I'm in the US, but they're rooted in the medical model. And there's a difference between the medical model and what they call the functional model. And the medical model is really based on a person having pain. They're going to their doctor, the doctor ordering a test or like an X-ray or an MRI, and that test will ultimately show them to have a problem in their spine. And the medical model says, well, that must be the reason that they're having pain. Let's try and fix that with either medication or surgery. And sometimes they'll order physical therapy. But the physical therapy or even the chiropractic would then kind of look at them differently and say, wait a minute, your MRI is not really the complete picture here. The MRI will show abnormalities, but there was a study done, it must have been now about 15 years ago, where 70% of normal asymptomatic people had abnormalities in their back MRIs.
It's amazing that a lot of doctors don't know that or recognize that when they look at that MRI, more times than not, there is let's just say, like, for example, a disc herniation on that MRI, and yet most of the time that is actually not the cause of their back pain.
Correct. Yeah, I can probably count on two hands, 2 feet, and a lot of other people's hands and feet how many people have come in with an MRI report and it says disc herniation, L5, S1, pressing on the right side nerve root. And meanwhile, their pain is left-sided. So I said, you know what? I don't think that disc herniation is really the cause of your pain. And what the functional model looks at is that your body is a whole system, and you're held together with not only your spine, but you're held together by muscles, ligaments, tendons, fascia, and all these other things that can exert a pull on the spine. As you were saying, we've kind of moved from the active caveman lifestyle to the seated sedentary. I'm working in a cubicle um, lifestyle, and those stresses are not normal for our body. That's not what we were put together for. We were put together for movement. We were put together for hunting, gathering, and roaming the earth. We're not put together to sit for 8 hours straight. So the functional model kind of looks at more of how we're put together, what muscles are pulling and creating abnormal forces on the spine, as opposed to just a photograph basically of your back. So, we need to, it's very hard to tell somebody and convince them that no, 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 whatever is happening in your MRI is not what we're going to address directly. We're going to address what's happening around it and try to correct a lot of these imbalances that are caused by your habits and by I guess, the industrial revolution's habits that have been thrust upon us. So, the big misconception that I see that patients come in just to kind of put it all together is that their X-ray is abnormal, their MRI is abnormal, therefore their back is abnormal, they will never be the same. But the reality is that it's all fixable with the right type of treatment.
And so I hear what you're saying is that a lot of the times there'll be something that's found on the MRI. So let's just give that example again of a disc herniation, and that's not actually the real cause of the back pain, but the patient is given the diagnosis of a disc herniation, and then they're told to have treatment for that disc herniation.
Mm-hmm.
So they might have the right diagnosis of a disc herniation, but that's not really the underlying cause of their back pain. And then they're going for the wrong treatment. And then what happens after that?
Well, then they end up going back to their doctor. They're not getting better. If you don't address that root cause of what's happening, just for as an example, I've had, and probably in your practice too, I've had people come in with sciatica. You do a very thorough physical exam as a therapist, as a chiropractor, probably as a physiatrist. They'll do a very thorough exam as well. But I've had people have sciatica, and I'll say, wait, well, your piriformis is really tight on that side. They're like, what are you talking about? Everything's from my back. I'm like, no, no. This piriformis muscle, I'm testing it. It's much tighter than the other side. The hamstring's much tighter. I think if we loosen that up, we can loosen up that sciatic nerve because that nerve runs right alongside those muscles, and I think we can get you some relief. And I've only had it happen a handful of times where someone would come in after the first session and they would come back and they would say, you know what? I'm about 75% better since we stretched out that piriformis muscle. This is something that the orthopedist is not going to examine. It's not going to be on their X-ray. It's not going to be on the MRI. This is only, a certain type of exam, certain type of physical exam performed by, like I said, a PT, a chiropractor, physiatrist. Locally here, I know when I tell people, you went to your primary care doctor, they're not really going to give you the diagnosis or the look-see that you need. Or they've been to an orthopedist who really just gave them medication and an X-ray and ordered therapy, and they're just not convinced that their medical doctor is doing the right thing for them. I'll recommend they go to a physiatrist. And they look at me and they're like, well, my feet are fine. And I say, no, no, not a podiatrist, a physiatrist. And I actually have to spell it out for them and, convince them that they might be a better person to look at your back than an orthopedist. So it's a tough road and it's sometimes an uphill battle, but a lot of times we're able to get them to the right, the right people that are going to look at the whole body as opposed to just what I call a photograph of them.
And Jamie, if we just step back a little bit to the
Hmm.
piriformis,
Hmm.
for our listeners out there, the piriformis is a muscle that sits on the back of your hip and deep in your butt,
Hmm.
and it's where your sciatic nerve comes out. And when that muscle is too tight, it's going to be pinching and irritating on that sciatic nerve.
Yes. And they've actually studied cadavers, and they found that piriformis muscle, in a certain percentage of cases, the sciatic nerve is known to run right next to the piriformis muscle. So if that piriformis muscle becomes inflamed, either because of your seated posture, because of just the habit of it's just not, you're not active and that muscle is not being used or stretched out, or I've seen people that just sit on their wallet all day and compress that muscle. So if that muscle is compressed and becomes irritated and tight, I think it was like a 3% incidence of the sciatic nerve actually coursing through the muscle. That's part of your anatomy. So that can directly affect what happens and the symptoms that you're feeling down the leg from a sciatic nerve entrapment in that piriformis muscle. It's actually probably more common than we think, right?
Yeah, I do remember when I was back in school, and of course, first trimester, we're doing anatomy and physiology, and we're in the cadaver lab doing dissection, and it was quite amazing how many people have a sciatic nerve that pierces straight through that muscle.
Mm-hmm. Yeah, and unless you address that and loosen that up, you're just not going to make any headway with their condition. And like I mentioned before, that type of anatomical alignment will not show up on an X-ray or MRI. What the X-rays and MRIs miss are the rest of you. So they're focusing on the spine and the intervertebral discs, but they're missing all the hip muscles, all the trunk muscles. They're just not part of the exam. That's why it's important to kind of get other opinions and get really physically examined. I think the art of the physical exam, at least from the people that I've seen, that's kind of been lost. Part of it's just the the trend that you only have like 6 minutes with your doctor one-on-one. So the doctor's going to try to maximize that time by going through your tests, and they just may not have the time to go through and do a full physical exam.
So it's important if you're suffering with low back pain to find somebody that uses this functional model to really get to the root cause of the back pain.
Yes, yes, I would agree. There's physical therapists, chiropractors such as yourself. There are also a fair amount of osteopaths, and some osteopaths are probably more so than I guess percentage-wise than MDs. A lot of osteopaths are trained with musculoskeletal backgrounds, and some of them are able to do osteopathic manipulations as well. So that's another type of doctor that you might want to look at. Again, hard to find. You got to do your research and your homework, but a physiatrist or osteopath is a real good first start. And some states don't have direct access to a physical therapist, so you'd have to go to either an MD, a DO, a chiropractor. And again, not all MDs, DOs, or chiropractors are trained the same way. So you might get a chiropractor that's trained in doing a lot of passive modalities. You might get one that just does manipulation, but you might find another one that really will take you through a rehab program. They're all different. They all have their own strengths and weaknesses.
That's very true. And I can attest to that as a chiropractor, knowing everybody in my profession.
Right,
And
right.
and for our listeners in Canada, if we go back to osteopaths in Canada are not the same as osteopaths in the US. So what Jamie is referring to as an osteopathic doctor is a doctor of osteopathic medicine. It's a capital D, capital O on their initials. And it's an osteopathic doctor in the United States is basically kind of like half a medical doctor and half a chiropractor. It's kind of like an amalgamation of both.
Mm-hmm.
So just so my Canadian listeners know that when you're referring to an osteopath, it's not the same as what we have here in Canada. So Jamie, over the years, I've heard many patients with back pain say they've been told by their doctor to rest their back. Just lie on the floor or lie on the couch until their back pain goes away. And of course, every time I hear this, I just cringe inside, and I bet you do too.
Yes.
Please explain to our listeners why taking such a passive approach and just lying on the couch or lying in bed, why that is not an ideal approach when dealing with a spinal problem.
Well, the moment you stop moving, that's when you start to atrophy. Now, atrophy means shrink. So your muscles will start to atrophy immediately. And we're not just talking about the back muscles. The back muscles have been documented to shrink with pain. And that's known to be there's a set of muscles that connect one vertebrae to the next called the multifidus. And they've had people with one-sided chronic back pain, let's say on the right, and they've actually been able to document that the multifidus shrinks with lack of use. When you're in pain and you're not moving, that muscle just says, you know what, we're going to turn off because you don't need us. So, to lay in bed and do nothing really has not been shown to ever help a back condition. It might, if you strain your back for the first 24 to 48 hours and you can't move, then I would say that's okay. But after 48 hours, for sure, you need to start moving, start activating the muscles, and try to prevent that atrophy from occurring. I think the old advice, even in the 60s, the 70s, and the 80s, and then people started to look around and say, well, the research really is not supporting anybody going on bed rest. You know, the musculoskeletal effects plus if you're on bed rest for a week or two, then you start to get impairment in your pulmonary system and your circulation. You start to develop a lot more secondary problems due to that lack of movement. So, the current recommendation, this is by multiple associations that deal with the back, is resume your normal activity within 2 days. So, I think they put a 48-hour cap on your bed rest if it's that bad. If you can move and you can get around from A to B, by all means, just try to maintain a normal life and try to obviously don't do anything drastic like lifting heavy items, but by all means move. So the moment you stop moving, that's when things start to cascade in the wrong direction.
So people stop moving, then they get more muscle imbalances that start. So Jamie, can
hmm
you talk a little bit more about muscle imbalances and what do you mean by muscle imbalance exactly, and how do we develop imbalances in our posture muscles?
Sure. There was a man who was from the Czech Republic. His name was Vladimir Janda, Janda. And I was lucky enough to see him speak in 2002 before he passed away, I believe, in 2004 or 5.
Jamie, I'm going to stop you right there and
Sure.
say I'm totally jealous.
Ah, you know him.
You're
Good.
very fortunate. Wow.
Ah, see that? Not everyone knows who he is or have heard of him, but if you know his work, you know how valuable it is, right?
It is, yes. Okay, sorry to interrupt.
That's fine. So, and if those of you that don't know him, I'll just tell you more about him and what his whole background was. He started out as a physical therapist in the Czech Republic, and he decided that after his physical therapy degree, he wanted to further that and become a physiatrist. So he was an MD and a physical therapist, and his life's work was to identify the causes of back pain and neck pain. That he devoted, the 50 years of his professional life to that. Unfortunately, a lot of his stuff was published in Czechoslovakian, so not everybody can read it. And when it was translated, the English is not great. It's hard to find. So it's a real gem of a compendium if you can find it. There's part one and part two. Plus, he's got a couple of VHS tapes out, not even DVD, but VHS. They might be on DVD by now. But in his work, he identified a list of muscles that were prone to being tight and muscles that were prone to being weak in everybody. And this is kind of like 100% of the population has these patterns that go through their bodies from head to toe. And he said the root of these postural patterns were actually in pediatric neurology. So if you see a child that has, any form of like cerebral palsy, you'll see the muscle patterns of tightness that develop and weakness are very, very similar to someone that may come into my office or Dr. Carri's office, but obviously to a lesser degree. It's not a neurologic basis. So if you look at like a child with CP, you'll see their hamstrings are tight, the calves are tight, the hip flexors are tight, the adductors are tight. They may have a little paunch in their belly, the erector spinae in their back is tight, their pecs might be tight, their biceps might be tight. All these things are happening, and if you just kind of if you had like a little screw in their brain and kind of unwound that screw a little bit, and then turn them into an adult, this is what we see, the same patterns of muscle tightness as adults, living their lives. And Yanda, one of his theories, this is, kind of an eyebrow raising statement that he said when I saw him. He said, the fields of neurology and orthopedics should be together because when you're dealing with the spine, they are so closely related that you have this neurologic tightness in these tight postural muscles that is in everybody to some degree, and you also have these patterns of having neurologic weakness. So weakness in the glutes, weakness in the abs, weakness in the muscles that bring your shoulder blades together, weakness in the ones that keep your head upright instead of forward on your head, the neck retractors they call them. So he was able to identify a list, and depending how detailed you want to get there, it's a list of kind of major muscles and a list of smaller muscles. But he could, he could. It was amazing when I saw him speak in the course. It was a 2-day course, and there was a girl there who was having problem with like this one hamstring that she kept straining. She was a dancer, and he could evaluate her entire body just by looking at her from behind. And he looked at the shadows and he looked at how the muscles fell and the gluteal folds and how the glutes sat. And he said, I see what's happening here. Your right adductor, your groin muscle, is tight and full. I could tell by looking at it. Your left glute is a little bit less, let's say, less muscular, so it's less developed. And he said, this is what you would need to work on. And it's amazing. He goes, I can evaluate anybody just standing there. I can look at their back, look at the postural muscles. I have to have the right lighting. He goes, but this is what I did in my medical office back in Czechoslovakia. And I was lucky enough to get my hands on his VHS tape. Now I don't have a VCR, so I can't play it anymore. But on his tape, you see him going step by step, like a 25-minute full body, head to toe evaluation of a patient. And he just shows how he does it. That coupled with a muscle length and a muscle strength exam. But it's pretty amazing what he came up with, and how these patterns are they're just so consistent from one patient to the next, and we all have them to a different degree depending on. I always say just how if your screw is too tight, you're going to have tight muscles. If your screw in your brain is a little too loose, you're going to be a little looser, but you need to get the strength in certain muscles back up together. The amazing thing is that I guess he called them the patterns that he calls them. In the neck, he calls it upper crossed syndrome, and in the low back, he calls it lower crossed syndrome. And you see people with shoulder problems, impingement, rotator cuff tears, they have these problems. They have upper crossed syndrome in addition to their shoulder dysfunction. So a lot of times the upper crossed syndrome and that muscle imbalance is mostly responsible for the shoulder mechanics getting out of whack. And same thing in the lower body, the lower crossed syndrome, that can imbalance a hip, imbalance, of course, their back. They can kind of cause their knee to not line up properly when they're doing sports and landing. So his work was really, really far-reaching, and it's a shame he passed on, young. He was like 74, 75, and he was a lifelong polio sufferer. He had two, I'll call them Canadian crutches for you, Dr. Carri. But yeah, Canadian crutches, lost-strand crutches. That's how he got around. I actually got into the elevator with him the first day of the course, and I got nervous. I thought I was next to Mel Gibson or something, like a big movie star. It was pretty cool. It was pretty cool.
I can imagine.
Yeah.
So Jamie, can you tell us about your rehabilitation program that you put together for your ebook. How is it different, and can you give our listeners more details about it?
Sure. Well, the ebook basically takes Yanda's work and another researcher that I follow is Stuart McGill, McGill. He's actually from, I think, McMaster University.
Yes, yes.
Yeah. And he, where Yanda was really good at identifying muscle tightness and patterns of, tightness and weakness, McGill was, much more modern, and he was putting electrodes in people and saying, all right, how do we strengthen the back and not hurt it? So he came up with a list of his recommended exercises to do to strengthen the back and not put extra pressure on the discs. And to me, I think there's no better way to strengthen than do it safely. So in addition to McGill's strengthening exercises, he also had a list of things to avoid. Certain exercises that are very, very common and they're commonly prescribed just to avoid because they put way too much stress on the intervertebral discs. So the ebook that I came up with is, part Yanda. I took his 10 kind of major muscle groups that he focused on in his list and made that part of the kind of part one of the program is to get things loosened up and kind of get you out of the woods. And based on my experience with using his program and his techniques, you want to get somebody out of pain before they begin strengthening. So once they're out of pain a little bit through the postural stretching, then we go into more strengthening. So the strengthening is more McGill, but I do also include some of Jan's glute strengthening, abdominal strengthening, and there is some overlap between the two, which is nice. So the whole idea is that the rehab, you want to be safe. You don't want to cause extra pain, and that's the one reason you would stop doing a certain exercise of any kind is if it hurts, you don't do it. You kind of knock that one out of the program. But most of the stretches are very, very light, very easy. You're not going to be twisting. You're not going to be, you may not even break a sweat because when you do back rehab, you may not even have to break a sweat. The moves are very, very gentle and very controlled, and you progress them kind of at your own pace, whatever your body is capable of.
So when they say no pain, no gain, that's absolutely not what we want.
And yeah, that's completely incorrect. I understand if you're a runner, a cyclist, a heavy weightlifter that you're trying to increase your strength or your endurance for a sport. Yeah, that you're allowed to endure muscular pain for that. But if you're trying to rehab your spine, pain is the enemy. You're doing these because you're in pain. So the one thing you want to do is not inflame that and not aggravate your condition. So yeah, everything should be very gentle, pain-free. If it hurts, you stop doing it. You retry it again in a week because you might be in a little better situation biomechanically to try that. Some people can't. They just cannot stretch their hamstring because the sciatic nerve is just too caught up in either the hamstring or the piriformis. So you say, you know what? Go very, very gently. If you're still feeling pain when you're going gently with this stretch, stop it. And you always have the option of restarting it. And there's enough other muscles that are connecting around the back and around the hips that will improve your mechanics where it may take the pressure off and you'll be able to get back into it, once you try again.
Jamie, I love that your program is based on two of the greats, Yanda and McGill. And as you said, it's all about using that functional model to figure out, is it the joint, is it the nerve, is it the muscle? And when it's the muscle, which muscle is out of balance, which muscle is too weak, which muscles are too tight. And so that's what your ebook deals with.
Correct. And it's an easy three-step program. The stretches are the first step. That just kind of, like I said, gets you out of the woods and gets you some pain relief. The second step is more of the strengthening and stabilizing the back, and this is more where, the more you do the strengthening, the better environment your back will have, and the more able you are to stabilize your back. And then the third part is the more advanced exercises. So that's really when you have no pain and you're on that path where you're feeling good and just another way to help challenge the trunk muscles.
So it's about first stretching the right muscles, and then second, strengthening the right muscles, and then third, going into the advanced stages. And how long does that usually take?
It really varies from person to person. I have in the book a 4-week introductory stretching program, a 4-week minimum
Hmm.
before you begin any strengthening. And just from my experience, 4 weeks has been enough to get a lot of people significant pain relief with that. So for the most part, 4 weeks would get them past that first part. If they're still having pain or they're still feeling tightness, then you can continue that stretching. Really, it's indefinite. You should be doing that for your lifetime if you're having, back problems. And then part two is the strengthening. Again, you can try that for the next 4 weeks, and then the advanced strengthening is kind of, as you need to, you strengthen and you up the ante, so to speak, for the back to help stabilize you. But all in all, within 8 weeks, you should be able to kind of go through the entire progression. And again, feeling relief. I've had people after 1 or 2 visits in my office, or 1 or 2 weeks with the book, and they're feeling a relief, significant relief, fairly early on. And it's surprising because you don't have to put a finger on their back, and they feel nice relief. And the good thing is they can do it themselves.
Jamie, how can the audience find out more about you? How can they get their hands on your ebook?
Sure. I have a website, which is howtohelpbackpain.com. There's also a blog on that website, which should have a daily article that I write related to back pain, or maybe related to a new study that came out relating to how you can help your back. And then I also have a weekly podcast on iTunes and Stitcher. It's called the Pain Free Podcast. And again, we have great guests. They focus on health promotion, pain relief, and everything in between. And also, I do a nice little 10 or 15-minute news segment in the beginning of the podcast that can give you, the latest news, the latest research, and stuff you can apply right away to help yourself, improve your health.
Jamie, thank you so much for being my special guest today. This was an awesome interview.
Thanks, Dr. Carri, and I appreciate you having me on and taking the time to learn more about me and my practice and my activities. Thank you.
All right, that wraps up this very special episode of the Functional Medicine Radio Show with Jamie Glick. And I want to thank you, our listeners, for tuning in today. And I'd like to invite you back next week for another episode of the Functional Medicine Radio Show. As always, I'm your host, Dr. Carri Drzyzga, the Functional Medicine Doc. Have a great week.
You've been listening to the Functional Medicine Radio Show with your host, Dr. Carri Drzyzga, known internationally as the Functional Medicine Doc. Dr. Carri is committed to helping patients find the root cause of their health problems and fixing the cause with natural treatments so they can feel normal again. Dr. Carri is the founder of Functional Medicine Ontario and is the author of the hit book, Reclaim Your Energy and Feel Normal Again. Please tell your friends about the Functional Medicine Radio Show, and we'll see you next week with more from Dr. Carri.